to initially, and then we want to get them ready. The patient, or so the family has visited now, and then we tell the family, whenever you're ready to step out, or if you want to make some phone calls, we'd like to give them a comfort care bath. And so we're going to go ahead and pull, if they're not a corner case, we will go ahead and pull out all of the tubings, all IVs, Foleys, trachs, anything that they have, we're going to go ahead and take out. If they are a corner case, such as they've been stabbed or shot, or they died and we don't know how, so there has to be a coroner done, there has to be an autopsy done. We need to be careful about promising autopsies. Let's say somebody had a cardiac event at home. They came in, they died in the hospital. If we're pretty sure it was a cardiac event, they won't do an autopsy. So you don't want to promise the family that they can get an autopsy, because it costs about $6,000-7,000 and they'll be paying for it out of pocket. So we need to make sure, that we're talking, let's say the person's getting close to death, we need to call the physician and ask if we don't know. But I will tell you, if it's questionable, if the police are hanging around, poisoning, more than likely it's going to be a corner case, okay? So in that case, we would tell the family we can't take off all of the leads and the IVs, we can't pull anything out, because they need to account for every hole, every mark, on their body, okay? So we want to lay them flat. You can put their head up just a little bit, but not very much, because rigor mortis will be setting in. We want to go ahead and give them a comfort care bath, meaning we might have to put on, clean their skin. They may have had stool or urine come out when they took their final breath. The other thing I'll tell you is, many times when you turn them on their side for this purpose, there will be a moan, because there's air in the lungs still that has not expelled. So just be aware of that. First time it happened with me, it scared the pants off me. So anyway, I like to tell people about that. Okay. All right, so then we're going to go ahead and put their hands across their chest. We've got all these little handy-dandy things. Now, I will tell you, every hospital does this a little bit different, and so I'm giving you the basics here, but I will encourage you to do whatever your hospital policy is. So we would want them to have their hands across their chest, and we have a string in here for that purpose. It can be a string, it can be one of these. I don't know, I lost something. Did you see it go? Okay, we want to put a tag on their toe, and we can take one of their stickers that says their name and everything and put on the top there. We want to put a tag with the sticker on the outside of the shroud, and then we have one more tag to go on their personal belongings, if anything's going with them. We want to go ahead and put their teeth in their mouth, and we want to comb their hair. Some of the shroud kits, this one in particular, if their mouth is open, we can use this to close their jaw, and we would just tie it on the top of their head. We also want to make sure their eyelids are closed. Okay, I don't usually tape anything shut until I'm ready to put them in the bag. Okay, so you don't want to do anything that might be disturbing to the family. All right, we have a blue chuck here. After we've given them the bath, we can put this up underneath them so that we can, if there's anything else that's going to come out. They'll also want you to put on a yellow isolation gown to go with them over there. Okay, this is if the patient has any kind of, let's say they came in with C. diff or any kind of infectious disease, we would want to notify the home about that, the funeral home. Okay, so the shroud is kind of like a big taco. Once the family has finished viewing, and most of the time they've left and we have notified the funeral home, okay, who are the other people we need to notify? You got to call the organ bank, whether they are an organ donor or not. We've got to call the primary care physician and any consulting physicians. We've got to let the supervisor in the hospital know, or our charge nurse, whichever day or night shift. And of course, we're notifying the family. And then we got to call the coroner if it's a corner case, and then we've got to call the funeral home. So there's lots of phone calls to be made. Okay, so now this is sort of like I said, sort of a big taco. And we're basically going to unzip it, roll it up, and slide it up underneath them. And then they're going to end up, you understand what I mean, like you're going to make an occupied bed. And then, so you'll need another person here. This is not necessarily a nursing role, But as a tech, I did this a whole lot. It's hard to do this, you know, if you'll pardon the pun, they're dead weight. So it's hard to get them in the bag. So just be sensitive when you become a nurse. You can't do this by yourself. And it's hard to be in a room with a dead body. The other thing I didn't say is we want to talk kind of like families get a birth plan. We want to get a death plan so that if there's certain things religiously, like they want their pastor there. The Jewish people, a lot of times they'll want to be in the room for the comfort care bath and take part in it. You know, we talked about this, having the window open so the soul can escape. Some people believe that. You know, some people want to have the last rites given if you're Catholic. So there's a lot of things that can happen that will be of comfort to the family if we get a plan and we know about it ahead of time. Of course, if it's a code, you know, we can't really do that. But if it's something that we can have a plan for. Once they're in the bag, we want to make sure that there's a tag on the outside of it. While the family is still there, we want to make sure that we've looked at all of their belongings. At the time, it's a very difficult moment to take off a wedding ring that's been on somebody's hand for 50 years. So we want to ask, you know, would you like to have this now? Sometimes we have to cut it off. They do have ring cutters, but we always have to have them signed before we do any damage to anything like that. That's part of the reason many of these people don't take them off, because they're kind of on there from swollen hands and bigger knuckles, etc. Arthritis. So we just really want to be clear. You know, remember these people are not thinking clearly. You know, nothing's getting in. Anything you say, they can deny later simply because they just didn't understand what you're saying. So we have to make sure that they sign. If for some reason something's left, like let's say they left and there's a necklace here, we want to involve security and have them put it somewhere so that they can get it retrieved through security, because you may not be here when they come back and get it. So just make sure that you have witnesses to everything you do involving belongings. You know, have somebody else come in and kind of witness what you're doing, because that's one of the things that I think that's come back on nursing a lot is families say, well, I didn't get this back, I didn't get, you know, they just don't remember. And so just make sure you document and that you put it in the right place. Okay, once the body is in the shroud, then we can take it down to the morgue if the funeral home has not come, because I'm sure your charge nurse is going to want that room for cleaning and the next person to come in. Okay. We want to put a note on the door that says "Do not enter," and the reason being is we don't want people who do not know that they've passed to come in and find them dead. It can be very traumatic. Plus, we want the family to notify who they want to notify. So if the neighbor comes in, you know, we'll just our comment is they can't be disturbed at this time. Please contact the family. And so that's what we say, because it's not our job to inform. Okay? You know, so then when they contact the family, they'll understand that they've passed. That's happened a lot. People come in, don't know, especially on Sundays. They don't know that they've passed, and they'll come to visit, and next thing you know. So it's really important to remember that note on the door. Okay? Did I forget anything with that? I believe there's a tie for the ankles, a tie for the hands. But again, this will be whatever kind of kit that you have at your hospital. You know, what they include and what they want you to do. Actually, it's based on what the nursing or the funeral home wants in the area. They'll tell you how they would like the bodies to be presented.
For this one, do you actually want us to put them in the shroud, or?
You can talk through it like I did. I mean, I hope you know how to make an occupied bed.
Yeah.
Mm-hmm. Okay, I think that the main reason we did this one was because we wanted you to have some idea of what this was, and to also be aware that as a tech, it's not easy to do this by yourself, so don't check it off. It's their job. It's not their job. It's our job. Okay, I'm done.